Okay, hi there. So welcome to another edition of Ask Dr. John. We're here to take a shallow dive, sometimes a little deeper dive into issues that arise from day to day in my practice and with my patients and other people that are just watching us. So we are open to taking your questions. It's great if you can send them to us in advance. Some of them I may be able to handle if you send them in on the chat, if we have time. If you send them in advance, even the day of, I can usually put together a quick PowerPoint, which then makes it more memorable, and you can go back and watch it in case you miss something. So I live for questions. That's my life. That's my job. I'm a questioner, and I love looking into questions with you and looking to see what we can discern together. So that's my purpose. So I'm going to go ahead and share my screen with you right now. Got a moderately long presentation, not real long, but moderate. So here we are, Q&A 517. So we're looking at micro-clotting problems. If you don't think you have a problem with micro-clotting, you are probably wrong. It's a very serious issue right now with the pandemic and vaccinations, et cetera. However, micro-clotting is always an issue. I was part of a summit this last weekend looking at combining functional medicine with traditional Chinese medicine. And I went through what I look for in an initial intake in my practice. And there were at least 10 things that point at micro-clots and blood stasis. It is what kills people. One of my heroes recently published a book on aging and blood stasis, and he kind of turned the entire Chinese medicine community upside down. So when I was in school, I was taught that aging and death is brought on by kidney deficiency. Now, translate kidney deficiency as hormone deficiency, because if you look at any of the aspects of kidney deficiency, kidney yang, kidney yin, kidney qi, they are all related to hormonal issues, male hormones, female hormones, and I use those terms advisedly because all humans have all of the hormones. They're just in different ratios. And then your adrenal hormones. And so when those are out of balance, when they're disrupted, then death occurs. However, this good doctor pointed out that really that's not what kills people. That's what makes people susceptible. What actually kills them and what ages them is blood stasis. For example, diabetes, high blood sugars do not kill people except in rare occasions. But the high blood sugars will lead to thick, sticky blood that will destroy the kidneys, will cause blindness, will cause peripheral vascular disease. But it isn't directly the sugar. It is the blood that can't move to where it needs to go. It can't supply oxygen, it can't supply nutrients, and it can't take away all the toxic waste products. The same with cardiovascular disease. It's really blood stasis. Right? Coronary artery disease, atherosclerosis, arteriosclerosis, stroke. Those are all blood stasis issues. So we've all got them. If you are aging, and I hope you are, then you have those issues, and it's good to be aware of them. Now, those of you that have seen me or you've seen an acupuncturist, you know that we put a great deal of attention on tongue and pulse diagnosis. So in the pulse, we can feel blood stasis very, very clearly. We can feel many other blood-related issues. And if we look at the tongue, we can also see blood stasis very, very clearly. Now, there are lots of other signs and symptoms on the body that we look at and or can look at that will also give us more information. So it's very, very rich. Okay, so let's take a little deeper dive here. So this is a question that came in, I believe yesterday. And this is a patient that I have been treating for a while. She was doing really well. Had gotten a vaccine, could not function for several months. right? Her job required her to talk to people and to do Zoom calls, and she was totally incapable of doing it. At around the same time, her young son developed COVID. And then when I saw them a couple of months after their vaccine experience and their COVID experience, they had almost identical symptoms. I mean, really, really close to identical. Now, mom was doing really, really well. And then I hadn't really seen her much. And this email came in. And so here she had got her chest pressure had gotten really bad. So she went to urgent care. They ran some tests, a CBC, a complete blood count, and a metabolic profile. And she attached those. And she said she guessed that her red blood cell count and hematocrit and hemoglobin are a bit low, and they were, but not low enough that it would have caused her symptoms. They couldn't find anything wrong, so they sent me home. But then this morning I coughed up some phlegm, and there was a bit of blood in it. So she went to the ER. They tested her D-dimer, found it was quite high at 2, and they want that to be 0.5 or under. So they did a chest CT with contrast and a leg ultrasound to check for clots, and they didn't find any. And that's pretty standard. D-dimer is used to predict, essentially in the Western medical system, in most cases, it's used to predict whether or not there may be a deep vein thrombosis or a clot in one of the deeper veins of the body, which can be very dangerous. It can move to the lungs and can move to the heart, or it can move to the brain, cause heart attacks and stroke. So it says, she said, that gave me some peace of mind, but I don't know what to make of the blood I coughed. And then she had some theories. But to me, this was a big, big deal. This is my week that I do projects, but I immediately got back to her. Unfortunately, I'm not in the clinic, so I was unable to do a pulse diagnosis or a tongue diagnosis. But I wrote back, dear her, the high D-dimer with the clear ultrasound points to a lot of microclotting. That is probably what's causing the chest bleed. If you can come by the office, it would be good to get some stronger anti-clotting items going. And I mentioned 3 items here. And if I saw her in person, I would probably recommend more or other. But without seeing her, these are really safe and they're very effective. And then I mentioned if you start menstruating, you may have a bit more bleeding. So be a little careful there, because it will thin your blood some. They call it thinning the blood. It doesn't really thin it. It just makes it so that it doesn't clot as easily. Okay, so the importance of the test. D-dimer is a marker for fibrin breakdown. So blood clots form. You get all these clotting factors that come together and they form a blood clot. As the clot is breaking down, excuse me, it's a multi-stage process, but one of the last processes is fibrin is released and it floats around the system. And so it's a marker for blood clotting. It's very standard to determine the likelihood of a deep vein thrombosis, again, a blood clot in one of the larger veins. And in most cases, when it's elevated, they do an ultrasound, and the chest CT was also fabulous. And again, they did legs and chest, which was appropriate. Now, that's as far as it goes. They sent her home, found nothing. But the tests were bad. You got to keep looking. Why would the tests be bad? There's a reason. That's why they have those tests, by the way. So most MDs are completely unconcerned. And I say this from a great deal of experience. They're completely unconcerned about the tiny clots that don't show on ultrasound. Now, I do a very thorough exam on my new patients, and I'm looking at several different signs of these microclots. Now, pathologists and epidemiologists from around the world are reporting massive microclotting disorders that occur in COVID cases and with vaccine injuries. I saw a summit yesterday, a video of a summit where 17,000 of the top MDs, pathologists, epidemiologists from around the world signed a consensus statement, and those are some of the things that they reported. that are not being well treated at all. In fact, in most cases, they're not being treated at all. And so I've done D-dimer tests that indicated significant elevations, and the patient said that the patient test was worthless. Well, then why do they keep running it, right? Yet it's used in medicine every single day. So it is not a worthless test. Okay. And so just from what I got from that simple email, the D-dimer of 2.0 in forms of clear fibrin breakdown, that's 4 times high. The high breakdown is anything over 5.0. So this is 4 times. And when you look at some of the research from around the world, which we're going to look at some today, it's a frightening level, actually. And the most likely reason for this is that blood clots have formed. And the ultrasound of the legs and chest is great. It rules out the big clots, the ones that, can kill you quickly. And so the microclotting seems to be about the only reasonable thing that's left. You can get some endothelial damage, right, which both long COVID and the vaccines do cause, where you get damage to the lining of the blood vessels, and that can also cause some of these tests. So because she had bloody sputum, I'm thinking maybe the microclots are in her lungs or in the bronchial tree, because again, you can't see them on the CT. Now, her MD was unwilling to admit her for a heparin infusion, and he hasn't even prescribed any blood thinners to treat the clots. And fortunately, traditional Chinese medicine is very good at treating what we call blood stasis, which includes blood clotting. And that's why I sent her those recommendations. Now, I would not send those to someone off the street that just send me an email, but she is a patient that I have been treating. So here's a study out of South Africa, and I've read several brilliant studies coming out of South Africa lately on microclotting and the blood types that it's more prevalent in, some of the SNPs, the genetic problems that make people more likely to develop the microclots, et cetera. So there's a lot of good information coming up. In this case, they had a cohort of 845 people that they identified by symptoms and by the fact that they had proven COVID, and the symptoms had been around for over 2 months. I think it was 12 weeks in their study. And so they were diagnosed with long COVID. And they took blood samples from 70, confirm long COVID. They outlined a 1-month dual antiplatelet therapy for 24 of them. So they did clopidogrel, which I've seen other studies that used a different blood thinner that I think was even more effective, but in this case, they used that one. And 75 milligrams of aspirin once a day, every day before breakfast. So again, a dual antiplatelet therapy. All 70 participants were determined to have had microclots. That's based on all the studies that they did of their blood, and that all 24 that received the antiplatelet and anticoagulant therapy had complete improvements. Most of them was complete remission, but they all had significant improvements in their long COVID symptoms, right? And also a huge reduction in microclots. And that was reported in Medical News Today. D-dimer as a prognostic indicator in critically ill patients. Now, wait a minute. Here's that worthless test again. But in China, they run a D-dimer literally on almost everybody that shows up at the hospital with COVID. And they have a much lower death rate from COVID than does most of the world. So they looked at this to see how important elevated D-dimer was. So they took a bunch of people, 343, and they used a cutoff of 2.0. Remember that number? That's the number that my patient sent over with her doctor not being concerned. So that was the cutoff. And anyway, I'm not going to go into this sensitivity and specificity. That would take a whole course. But here's the bottom line. Look down at the numbers in green. If the D dimer was greater than 2.0, 12 out of 67 people died. If it was less than 2.0, 1 out of 267 died. That's an insane difference. Insane difference. And many hospitals I didn't put that study in here because I couldn't find it. I've got it somewhere. Will check D dimer and they will quartile patients. So if they're over 0.7 up to a particular number, they will usually do out of hospital treatment. They take home treatment. If they're at the next highest level, and I don't want to quote that is because I don't remember it exactly, but if they're in the second quartile, then they are given pretty strong treatment and sometimes hospitalized. If they're in the third level, they are always hospitalized, usually in intensive care. And if they're in the highest level of D dimer, they are expected to die. That's how important that test is. They are just, they're going to try to save them. They're going to do everything they can. They're going to put them on heparin and anti-inflammatories and everything else they can. But they know once you get into that top quartile level, it's quite dangerous. So anyway, big deal, D dimer. At Baylor, you all heard of Baylor. This was a little fascinating. So they did standard clotting profile on patients. I didn't say what they did, but I assumed a few things, prothrombin time, INR, sedimentation rate, things like that. But they didn't say, they just found that's the first level. They then went to the second level of more specific tests, which are fibrinogen and D dimer. And those are the tests that I run, fibrinogen and D dimer. So fibrinogen is the protein that makes up the clot, and the D dimer levels indicate that the patient's clots are being broken down. One builds it, one breaks it down, but they will both be elevated in these conditions. So for the COVID-19 patients in the ICU, they found that the levels of fibrinogen were more than 3 times the normal range. Now, fibrinogen is a grossly overlooked blood factor. I'll be talking about that. Catherine, I'll be talking about that in the book that we're bringing out this summer, how unfortunate it is that there are a few tests that are basically just overlooked, fibrinogen being one of them. And I don't mean it's overlooked. I mean, if it's astronomically high or extremely low, someone's going to pay attention. But much lower levels than are looked for can also be lethal. The same with platelet levels. So here we are with fibrinogen and D dimer. Here's the interesting thing, though. They did the third level, which is a thromboelastography test for the risk of forming blood clots. And this is only used generally if they're looking for someone's having a heart surgery or they're having something, brain surgery, where this is a really, really, really big issue and can kill people quickly. And they found a very high number of COVID-19 patients that tested positive with this TEG test that were undetected on the other tests. Now, unfortunately, you ain't going to get this test. Talk to your doctor and they're just going to look at you and kind of laugh. However, a D dimer and a fibrinogen is another issue. You may be well able to get those. They're routine in my clinic for these problems. So my takeaway from these studies, and dozens more, dozens and dozens and dozens more. These are the principles that I go by. All long COVID patients should have appropriate testing done. So if someone has COVID, 3 weeks later, they feel great. By the way, with this latest iteration of a variant, I found quite a few patients that felt pretty bad, but it was kind of like mild flu, then felt pretty good, went back to work, and then got really, really sick, very sick. On death's door kind of sick. So if you do get COVID, don't be cavalier about it. You want to take your time getting back up to full activity, even after you feel good. So, in my opinion, all long COVID patients or anybody that's not feeling better after a month even should get fibrinogen, D-dimer, platelets, CBC, and a Chem 14. All of those together is not that expensive. $60, I would guess, maybe $70, somewhere in that range for all of those, and well worth doing. Now, if you want to go beyond that, you could get a prothrombin time. I don't do that because I find I get enough information from the other things generally. Cytokine testing is the gold standard. However, it's very expensive, and usually insurance, it definitely won't pay if I run it. But generally, even if you go to a Western medical lab, Stanford, usually your insurance won't pay for it. Dr. Patterson at Stanford has developed a very specialized COVID panel. It's brilliant and it's amazing. And one of the things it does is it allows the level of inflammation to be tracked, because the cytokines are cause inflammation and they're inflammation markers. And he has pulled out a particular group of cytokines that is elevated in long COVID, and he monitors it, and he has a magical treatment for it. However, I don't know any other doctors other than those people at Stanford that are currently using it. So anyway, testing, you need testing. My next item is all COVID vaccine injury patients should have the same testing done. All patients should consult with their MDs for appropriate treatment. If you've got a D-dimer test of 2.0 or higher, and you've got elevated fibrinogen, it is my opinion that you should be either hospitalized on heparin, or, and I'm not an MD, I can't do that, or you should be getting very strong dual antiplatelet therapy, such as they did in South Africa. So I think you should consult with your MDs, try to get the treatment. If they won't supply the treatments, you should seek appropriate treatment from other medical sources. You could see now most acupuncturists aren't as clear about, I teach this. And so but most acupuncturists are not as clear, but there are acupuncturists treating this. A functional medicine MD would be a great choice. They're very expensive typically, but very good. You could go to a chiropractor that utilizes supplements and understands this. Most do, some don't. Some just do adjustments, and that's fine, but it wouldn't help you much with the blood stasis. A functional medicine nutritionist, not just any nutritionist. Most of them will have no idea what to do for blood stasis and micro-clots. That is not what they do. So you need someone that was a functional medicine nutritionist or clearly understands blood stasis. Or you could go to a naturopath. Okay, and I'm sure there are lots of other things I haven't mentioned out there, but that's just to give you an idea. So the most basic items I recommend, and so this is what I recommended to the patient before. I recommended nattokinase to lower blood clot risk and dissolve fibrins. I recommended serrapeptase, which is sometimes called serratiopeptidase, to break down clots and fibrin. And I recommended herbs to resolve the blood stasis and to break down micro-clots. And then, so that's what I recommended for her because I didn't see her in person. Now, then I would look at herbs to resolve any other inflammatory conditions. So I might, use Huang Qin or skullcap or andrographis for the lungs or for inflammatory buildup in the lungs. And so there are herbs for everything. Then, and this is really way too overlooked, I would give supplements, and I do give supplements to reinvigorate the immune system. It's clearly possible to catch COVID multiple times. I have patients that have tested positive 3 and 4 times. I have family that I know that have had COVID 3 times. So you can definitely catch it. And at the time of this writing, I swear 17,000 doctors, the top people in the world, are saying that the majority of those testing positive are vaccinated. I'm not saying don't get vaccinated. That's not the takeaway. What I'm saying is if you've been vaccinated, you're not protected. Okay. So go ahead and vaccinate if that's your choice, and then take the supplements that you need to reinvigorate your immune system. Okay. And there are very specific ones for viruses. There are a whole range of immune system stimulants that are very, very good for viruses. Okay. Now, nattokinase, and when I say has been found, I'm not talking about, some acupuncturist in their clinic. I mean, I think that's valid information, but that's not what I'm talking about. When I say these things have been found, I mean, there's a great deal of research, not one study, not two, but a lot of research showing that these things are what it says here. So they keep the blood flowing and they promote cardiovascular health. Now, the combination that I'm going to talk about today is really good to prevent blood clotting in general. There are studies showing that nattokinase, serrapeptase, and one other thing that I didn't mention here can prevent deep vein thrombosis after airline flights by 80%. Now, not generally known by the public, there are years when 100,000 people a year die from deep vein thrombosis after airline flights. I personally know a couple people who died, or I don't know them anymore, but people who died after airline flights because that being stationary in that position, often being dehydrated, and the changes in the way the cabin pressure is done, all of those things contribute to form deep vein thrombosis. Also, long driving trips have been found to facilitate or make it more likely to get deep vein thrombosis. So if you're going to do a trip, take these things, right? You have nothing to lose. And there is one caveat that I'm going to mention in a few minutes, but you have everything to gain. They're inexpensive and they're very effective. So nattokinase, it's an enzyme. It's from natto, which is in my opinion, an inedible food from Japan. People that ingest large amount of natto are some of the healthiest people in the world and just don't have heart attacks. It just pretty much doesn't happen. But I can't really get close to it. It just grosses me out. I've had several patients just be really loving and bring it to me. And it's like, oh God, this is going to be close. And so I take a pill, much easier. And this has been researched in Japan for decades and decades. I have a whole magazine from one of the nutraceutical companies that was devoted to nattokinase studies from about 20 years ago. So this is not something new. And by the way, these things are used by many doctors outside of the United States. It's just a difference in how they look at issues, okay? It can lower blood pressure. It can reduce the risk of atherosclerosis. And this is often misunderstood. Athero means porridge-like, right? Sclerosis means hardening, like scarring. And so atherosclerosis is the buildup of this porridge-like substance called cholesterol on the lining or inside the lining of the blood vessels, and then can eventually impede blood flow and lead to clotting. Arteriosclerosis is a hardening of the arteries, but without the porridge. Okay, so that's a little different. It can lower lipids. Those are those nasty blood fats that your doctor's constantly trying to get you to take statins for. It supports optimal blood flow with its anticoagulant properties. Oh, by the way, I'll have people say, John, why should I listen to you? And I'll say, I don't know, right? I just do my best. I do a lot of research. I love people in general, and I kind of want to get the word out there. I said, but I'm wrong. I can be wrong. I have been wrong. Always do your own research. But I'll tell you, there's one thing that sets me apart a little bit. I don't make nattokinase, right? Whether you take nattokinase or not, in general, I'm not going to make a penny on it. I mean, if you're in my clinic, I'll make a few dollars on it. However, if it wasn't that, I could sell you something else. You know what I'm saying? So I'm not pushing nattokinase because I have a company that makes nattokinase. I'm pushing it because I've seen it work. I've seen it work on me on a level that you wouldn't even believe. I'm not going to go into the details at the moment, but there was I'll go in a little bit. So there was a time when I had to be very, very stationary. And I was pretty much confined to my recliner. And I developed blood clots from the medial malleolus, that's the bone on my ankle, on the inside, all the way up past my knees in both legs, right? Got my ultrasound. Now, the first ultrasound completely missed it because they only looked for deep veins. And the saphenous vein, where I had this blockage, is a superficial vessel. And so I went to a physician's assistant who was superb. He said, no, you've got to go see this guy. He is a magician with ultrasound. And he let me watch while he did it on the screen. And I could see it was completely clotted from my ankle past my knee. So the report went over to the doctor and he said, oh, we're going to have to admit you. Well, let me think about it. We may just strip your veins, et cetera, right? And I said, okay, well, you decide. I'll be back next week, right? While I was gone, I did all of the substances that I'm talking to you about here. Plus, I did a very strong B vitamin supplement because I tend to be B12 and folate deficient, which can also assist in sticky blood. But basically, I use nattokinase, I use serrapeptase, and I use Chinese herbs. And when I went back, they were stunned, absolutely stunned. In fact, their comment was, gosh, I've never seen this guy make a mistake before, but obviously you couldn't have unclotted during that time. Which I hear all the time, it couldn't possibly have happened, even when it's right in front of their face. So that was my experience with this. So it's an anticoagulant and it may be neuroprotective. I don't use it for that so much because I haven't seen as much literature. So nattokinase dissolves fibrin. What are clots made of? Fibrin. So other things also, but if you dissolve the fibrin, the body starts to destroy the clots. They fall apart. However, even if you don't have clots, as we age, we experience an increase in blood viscosity. It gets thicker. Our blood gets thicker as we age. So blood that's too thick is more prone to clotting, and it doesn't flow as easily through the blood vessels. I mean, that makes sense, right? The heart is only about the size of your fist, okay? And it's pushing a relatively thick liquid through over 70,000 miles of blood vessels. That isn't what happens, but that's what we're told. Actually, most of the pumping is done by your arteries, which are very strong, very muscular. If one's heart stops, they do die. However, if your arteries aren't doing their job, you're not going to move your blood either. So that's a really, really important thing. And so if it's thick, you're going to increase the blood pressure, right? It takes more pressure to get that blood, that thickened blood, through the arteries. So the heart has to pump harder. And there's no doubt about it that nattokinase helps to decrease that thick blood and supports healthy blood flow. Okay. This study, and there are lots of them, this is just one. This was randomized, double-blind, placebo-controlled. That is the gold standard in medicine. Those three things. God bless Archie Cochrane, who the Cochrane Collaborative is named after. He's the guy in Scotland who created the randomized, double-blind, placebo-controlled trial that is really the gold standard, as I said. And they looked at 86 people that had high blood pressure, and they used either nattokinase or a placebo for only 8 weeks, 2 months. There was a significant reduction in blood pressure amongst those taking nattokinase. As I mentioned, you get atherosclerosis or hardening of the arteries. In this 26-week study, the volunteers took either 300 milligrams of nattokinase, that's a pretty hefty dose, or 20 milligrams of the day of simvastatin, which is a statin, an anti-cholesterol medication. Now check this number. Okay. Now, simvastatin has all kinds of side effects, potential side effects. I mean, it really does. It's not a benign drug in any way. Nattokinase, very benign. The arterial wall thickness, which is one of the major diagnostic tools, and especially in studies, and the size of the arterial plaques decreased. Now check the numbers. Take a look. The plaque size decreased by 36.6% in the nattokinase group and 11.5% in the simvastatin group. You might want to find that study. I didn't list it here. Catherine may put it at the end. I don't know. But this would be a great one to help educate your doctor. Not that they're going to change their prescribing advice, but we have to keep getting this information in front of them so that they start questioning what they're doing. You get a patient that goes on simvastatin, they come in with the side effects of simvastatin, right? Muscle aches, memory issues, etc. Not everybody has that, but a significant number do. And so what do? Well, you could tell them to take some nattokinase, which is better, 3 times better, and also has the benefit of thinning their blood. So you see, though, the nattokinase is actually taking the place of multiple pharmaceuticals. So, and here's what I'm talking about. So the nattokinase volunteers had reductions in total cholesterol, low density lipoprotein, that's the bad stuff, and triglycerides, which is actually even the worst stuff for most people, while it increased their good cholesterol. That's crazy. That's crazy for a few pennies a day. Okay, here's a study up on top on carotid artery issues. So they're saying that their findings from this study suggest that daily NK nattokinase supplementation is an effective way to manage the progression of atherosclerosis and potentially maybe a better alternative to statins, which are commonly used to reduce atherosclerosis and further to prevent cardiovascular attack. Now, I want you to read that over a few times. I want you to pull up that study. You can find it. It's not hard to find. It'll take you 2 minutes, and take a good read on that one. Even if you're going to do the Western pharmaceuticals, if you add this, in most cases, again, there's some caveats when you wouldn't add it, but if you add it, you should get 3 times better results. Sounds awesome to me. Okay. Now, here's the caution. People who would take blood thinners, including warfarin, but any of the blood thinners, need to know that nattokinase may promote bleeding and easy bleeding or bruising. And if you're taking a blood thinner, you should always consult your doctor before taking it. So I want to give a big shout out to Ron Grisanti at Functional Medicine University. Most of this information on nattokinase, not the studies, but all the other information is from Functional Medicine University and supplied by Dr. Ron. So we really want to give him a thanks. He does some great work in the world. Okay, Serrapeptase. This is the second thing. Now, you might remember the supplement that I recommended to the person with the D-dimer was something called nattoserrazyme. And that is because we found that it's much easier for people to take 1 pill than it is to take 4. So this is a higher dose nattokinase and serrapeptase than we get in most of our supplements, and they're combined together. So we find that that's very effective. So after a silkworm reaches maturity within the silk, right, the cocoon, the moth has to get out of the cocoon. That is incredibly strong. It is amazingly strong. So it releases proteolytic enzymes to make the hole in the cocoon. It basically burns a hole in the cocoon so it can emerge as an adult moth. And when they're making silk, they actually kill the silkworm or the moth. I get probably in the silkworm stage, actually, so that it doesn't destroy their silk, because silk can be in hundreds of feet long, over a mile. And if you burn it, then you get random length. And they actually use that random length for a few things, but you really want the mile in length strand. How strong does that have to be, huh? Crazy. So the primary proteolytic enzyme, lytic means it breaks down, destroys, and proteo is for protein. So it breaks down the silk, and it's called serrapeptase or serratiopeptidase, depends on where you look. And it will reduce any inflammation in the area, and it breaks down the scar tissue without affecting healthy tissue. And this was a study. I found the study quoted in the Irish Examiner, but it was a medical study. And so it improves wound healing by clearing old or damaged tissue, including blood clots, mucus, cysts, arterial plaque, and fibrosis. Now, if you look at the information on serrapeptase and nattokinase, they both say you have to be very careful with liver cirrhosis because it's going to destroy the tissue. My experience is we have reversed liver cirrhosis in at least one patient by using these to break down that dead liver tissue. So anyway, but talk to your doctor. It's from Yashoda Hospital in India. There's a question and answer page. And second question was, how does serrapeptase work? Good answer here. It binds with microglobulin in blood plasma, which helps it reach the inflamed area. So that gives it a chariot to ride around the body in until it gets to the inflamed area. It also helps relieve pain by eliminating bradykinin, and that is a compound that instigates pain. It also reduces the chance of heart attack or cardiovascular disease by breaking down the fibrin. So naturally, serrapeptase helps in breaking down the fibrin and fat molecules, and it increases blood flow. Pretty good deal. Okay, here's a little video. And this is from a company that sells this herb, Danshen, D-A-N-S-H-E-N. When I was in school, I remember every single Chinese doctor over 45 or so they have these double wall glass containers that they put hot water in over their herbs. Every single one of them sipped Danshen all day long. They would put the root in there, it comes as a root, and they would just continually pour hot water over it during the course of the day. And it's an amazing herb. Now, this is not a great video. I took it off their site, but I'm going to have to walk you through it a little bit. They used to have a really good one, but I couldn't find it. So this is a video of blood flow, obviously. So here we see the blood. There's kind of flowing through pretty well. Now here we see this is the plaque and the platelets that are forming, making clots. You can see right along that arterial wall, and you see they're getting bigger. Here's a huge platelet aggregation there. And so you see the blood's not going very well, okay? Now here, this is an area that is dead from the clotting, but you look at that blood flow. It's now racing through there, right? Racing through there because this is 30 minutes after administration of Danshen, okay? So pretty cool. Well, let's see if we can get, okay. Bottom line, long COVID is very real. I had patients from all over the country come see me, and it's horrible. Vaccine injuries are occurring. They're occurring at a rate that most people don't really understand or believe. And there are tests available to clearly identify every one of the problems. There are numerous, inexpensive, scientifically proven, over-the-counter, natural treatments, having no side effects to help these conditions. So find a practitioner that takes your problem seriously and knows how to treat it effectively. Don't suffer needlessly, because this can be life and death. It's bad enough to feel bad, but when that patient's D-dimer gets up over 2, remember the chances of dying really skyrocket from that Chinese study. So take this very, very seriously. If you feel like you haven't fully recovered from COVID or a vaccine, get your doctor to run those tests. They are very inexpensive. Okay. So stop sharing. There I go. Do we have any questions?
We do on our Facebook. Adelaide from South Australia has a question.
Hey, how cool. Hi.
Love listening to your podcast and wish you were here in our city so I could have an appointment with you. I listened
Just so you know, I actually had someone come see me from Australia, right? Just to see me.
That is very cool. I listened to your discussion of magnesium, hoping you can help me as I couldn't catch the name of the magnesium I think might help my son-in-law. He had COVID and that affected his heart rhythm, goes fast even with light exercise. He is training to be a policeman, but unless he gets his heart better, he cannot continue his course. He has lots of medical tests, no diagnosis. Can you please tell me the brand or type of magnesium more helpful for heart irregularities? Please come and visit Australia.
Most magnesium is helpful for heart rhythm. If someone comes into the hospital, and many hospitals at least, with a heart attack or even a suspected heart attack, they do a shove. They push huge amount of magnesium to get the heart to relax. If it's primarily cardiovascular, I would probably go with magnesium citrate, malate, taurate, any of those are good, anything that ends with ATE. Glycinate is a little better for sleep and doesn't have as much excess bowel activity. And threonate penetrates the blood-brain barrier. It's the one I use most often, but for the heart, any of the forms that end in ATE should be fine. Now, I hope you're listening to today's presentation because I just went through a whole list of things that can help with the inflammation in the heart. Okay? So hopefully you can listen to that. Okay.
And then we have another question. Which brands of Nattokinase and Serrapeptase do you recommend?
I find that they, as far as I can tell, I mean, I hear debates. There's a lot of debate, which are good, which are bad. We buy our stuff from really, really reputable companies. My favorite is Orthomolecular. I think the research department is astonishing. However, we get
Nattokinase from Orthomolecular and Designs for Health.
Nattoserrazyme. Yeah. So Nattoserrazyme, which I now use more often because I don't have to give people as many pills, we get from a company called Designs for Health. Designs for Health. And that's what I take because, again, I'd rather take one pill than four. And it's very high dose. So that's what I recommend.
Okay. And what do you think about Health Concern supplement of the Serramend? We carry that one too.
Yeah, we carry that too. I think it's fine. It's a very good company, very reputable company. They've been around for a long time. Their kind of claim to fame is their supplements are generally food-based, which I think is great. But again, you get different strengths when you're doing food-based versus non-food-based. But we have used their product and we've had very good results from it. Again, I just like the idea of getting a much higher dose. And I started going with the higher doses after I started reading, because of long COVID and vaccine injuries, I started reading more research and they were using much higher doses than I was using with my typical patient. And again, so it's much easier for me to just give that Nattoserrazyme. And I don't get anything from any of these companies.
Okay.
Darn it, they should pay me, huh? No. All right. Anyway, I want to thank you for tuning in. Hopefully this helps you. Please forward this. I guarantee you have friends that are, there's no doubt, who are suffering from micro-clotting and blood stasis issues. Try to get this out to them as just a little something to spur their interest to take care of themselves. So until next Tuesday, be happy, be healthy. Thank you.